How do leukemia prognostic markers work? Imagine trying to predict the future of a disease based on clues hidden inside the cells. That's exactly what leukemia prognostic markers do. They are biological signals that help doctors understand how the disease might behave in each person. These markers are like fingerprints of the leukemia cells, revealing their unique genetic and molecular makeup. By analyzing these clues, doctors can estimate how aggressive the disease is, how likely it is to come back, and how well a patient might respond to treatment. This information helps shape personalized treatment plans and gives patients a clearer picture of their prognosis. One of the main ways these markers work is through genetic and molecular abnormalities. Leukemia cells often carry specific gene mutations or chromosomal changes. For example, mutations in genes like NPM1 or FLT3 are common in certain types of leukemia. If a patient has an NPM1 mutation without FLT3 IDD, they tend to have a better outlook. But if there are mutations in TP53 or complex chromosomal changes, the prognosis is usually less favorable. These genetic features influence how quickly leukemia cells grow, how they survive, and how they respond to treatment. Another important group of markers are immunophenotypic markers. These are proteins found on the surface of leukemia cells, detected with a technique called flow cytometry. Certain proteins, like CD38 or CD49D, can tell us how aggressive the disease might be. For example, high levels of CD135, a receptor on leukemia cells, are linked to poorer survival in acute myeloid leukemia. These markers also help distinguish leukemia cells from normal cells and can show how the disease might evade the immune system. Serum biomarkers are also used to gauge disease activity. Markers like lactate dehydrogenase or beta-2 microglobulin are substances found in the blood that reflected how fast the leukemia cells are dividing and how much tumor burden there is. Elevated levels of these markers often mean the disease is more aggressive and may progress faster. Advances in understanding microRNAs and gene expression profiles add another layer of insight. These small RNA molecules can turn genes on or off, influencing how leukemia develops and progresses. For example, certain microRNAs are associated with either better or worse outcomes in leukemia patients. Changes in immune cell populations, such as natural killer cells, can also signal how well the body is controlling the disease and can be linked to prognosis. All these markers are often combined into risk models or scoring systems. These tools integrate genetic, cellular, and clinical data to classify patients into different risk groups. This helps doctors decide whether to pursue more aggressive treatments or opt for less intensive options, tailoring therapy to each individual's disease biology. In practice, leukemia prognostic markers are invaluable. They help estimate the chances of remission, relapse, and survival. They also guide ongoing monitoring after treatment to catch early signs of disease returning. By revealing the biological behavior of leukemia, these markers enable more accurate predictions and better informed medical decisions. It's important to remember that each person's disease is unique, and these markers are just one piece of the puzzle. Always consult healthcare professionals for personalized advice and treatment options. As research advances, these markers will continue to improve, offering hope for more precise and effective leukemia care.